So we are hearing a lot of this terminology, mucormycosis or the black fungus. It has hit us like a Black Friday. So can you throw some light on this?
Absolutely. Mucormycosis is a deadly fungal infection, extremely rare, but when it comes, it can really have a devastating effect on us. Now, there are certain funguses like mucormycosis, aspergillosis. These are normal commensals many times inside the oral cavity or in your maxillary sinus. Sinus is what we call just around, just behind on the, behind the cheeks, next to your nose. These are sinus cavities. Inside that, many times you can have these normal kind of fungal strains which are there. But when your immunity comes down, for whatever reason, you could be a poorly controlled diabetic or you could have had chemotherapy, that's when your immunity comes down. Now, with this COVID infection, generally your immunity would have, any viral infection brings down your immunity. That is one. And on top of that, when we have had actually a lot of steroids being administered, and especially if you're already a medically compromised patient, you're a diabetic, for example, or you're immunocompromised in terms of so many other conditions, then you are very high risk for mucormycosis. Now, what tends to happen in mucormycosis is sometimes suddenly your teeth are all firm, they start shaking. You get very foul odor. You get pus discharge, multiple pus discharges coming in from around the teeth, from the gums, basically. This is a bad sign. And that indicates that you are getting a fungal infection. Now, we need to treat it aggressively. We need to take out your, the teeth which are affected. Many times we may have to take out a part of the jaw. In fact, if the infection spreads further into your eye socket or it goes into the brain, then it could be even fatal. So it's extremely rare, but now we are seeing a lot of cases because of COVID infection. And that is one reason why I would like to say, please do not self-medicate. You need to be basically monitored if you're taking steroids. Your physician will monitor you and will administer you the right dosage. So you can actually harm yourself if you self-administer.